So welcome, Lisa.
So I think I'm just reflecting on the energy, the great energy here today, and Ken, looking at you and thinking about the 40 years that this organization has been around, and talking with a lot of the faculty and the excitement around this new chapter in this organization's life. And what is very telling to me is that it's not just about the Center for Infectious Disease Research today. They have invited everybody in the community, and that's the way we roll here in this state and in this region. And it's what makes us so remarkably special, is that sense of collaboration. We have hundreds of global health research and delivery organizations in this state. Did you know that? More than 200. And we are, Washington Global Health Alliance right now is undertaking an updated economic impact analysis and landscape analysis that'll be rolled out in September. But we already know that these organizations work in more than 160 countries. The economic impact for this state is remarkable, but even more important is that we are helping heal those most vulnerable in this world. We are looking for solutions for their lives, they who have no voices. I'm looking at Corey Casper from the Hutch and the people from the UW and Stefan Kappa, who's working on the malaria vaccine trials. These are people who work sort of in obscurity and have been working on these problems for decades. And yet, we have this tremendous intellectual property in this state that we export to the rest of the world. And the fact that we do this together, that importance of the collaboration. This state is an incubator for global health innovation and life science innovation. And it's particularly special because we know that we cannot do this alone, any of us. And so that's why about 8 years ago, we started with the Washington Global Health Alliance, which is the first alliance in the world dedicated to bringing regional partners together, to connecting, finding ways to collaborate, finding ways to connect that we hadn't thought about before. And so we have this brain trust that we've created, and the Center for Infectious Disease Research is a founding partner of that coalition. We started with the Center for Infectious Disease Research, I still have to get used to that, and along with the UW, WSU, PATH, Fred Hutch, and the Gates Foundation, because we all recognize that we can do this together better. We play to each other's strengths, from discovery all the way to delivery, from bench science to translational science all the way to delivery on the ground, from Center for Infectious Disease Research to the Infectious Disease Research Institute to World Vision and PATH for that delivery on the ground. These ideas that are starting here in the labs here are being realized on the ground, both internationally and locally. So the Center for Infectious Disease Research is at the heart of this remarkable concentration of global health and life science expertise. I mean, you talk about an export for this state, right? What better export can we think about than providing health, wellness, and good lives for people? Again, whether it's here in South King County or whether it's internationally. So what I love is your new brand on people, science, and hope, because I think that so clearly identifies and captures what we're all in this for, what we all care about here. And we can take such pride in that, and I congratulate you on this next chapter, Alan, John, and the entire center. So congratulations.